Hi, I am Sangeeta Dhawla and now I am going to take you through the topic Psychosocial Dimensions of Chronic Illness and Disability. It is seen that serious illness or a serious injury generally take a lot of time for the person to get back to normalcy. But even once he gets back to normalcy, it is seen that he cannot become his earlier self. Many victims of serious illness and accidents face a lifetime limitation such as physical impairment, demanding routines of care and even social isolation. For the chronically ill patient who never really gets better, the threat of medical crisis always looms large in his eyes. Despite precautions, medical crises can become regular events and can absorb tremendous amount of energy, time and effort from the person. Further, there are also a lot of reminders throughout the day that he needs to keep track of, and this becomes totally pressurizing on the mind of the person who is chronically ill or disabled. Let us first understand what is chronic illness and disability. Chronic illness and disability involves one or more impairments or deviations from the normal structure and functioning. And one has to remember that these impairments are permanent or semi-permanent. Chronic conditions are always caused by pathological alterations which are irreversible or at least very difficult to change. They are generally accompanied by residual disability. Putting up with a chronic condition calls for regular treatment, supervision and special training. Unlike the acutely ill or injured person who remains hospitalized only for a certain amount of time, the chronically ill or disabled patient must eventually try to learn to live with his disabled personality. The individual must attempt to maintain some degree of independence and achieve as high a quality of life as possible with the constraints that he now has. Chronic illness is surprisingly very common. Chronic illness includes some conditions like heart disease, kidney failure, diabetes, ulcerative colitis, leg or hip impairments, visual impairments and sometimes even psychiatric conditions. The most common chronic condition of people under 45 years of age is found to be paralysis, and what comes in with paralysis is the limitations of the lower extremities. For people who are above 45 years of age, the most common chronic conditions are rheumatoid arthritis, osteoarthritis and heart disease. For non-elderly adults, like those people who fall in the category of 18 to 64 years, the problems that account for most activity limitation are back or spine problems and lower extremity injuries, heart disease, arthritis and eye problems. The older a person is, the more likely he is to get some kind of a chronic illness or disability. But we cannot rule out the proposition that even the young can be struck with some kind of a chronic illness or disability. One thing we can understand clearly is that these chronic illnesses and disabilities have no cure at all. This is one fact which has many important implications for the psychological and social adjustment of the person who is stricken with the condition. For example, let us take a person who is disabled. He meets with an accident, he loses his leg. So far he was fully independent, walking, running, jumping, hopping and skipping. But because of this accident, he has met with a disability, he has lost his leg. He cannot jump like before, walk like before, hop like before and do anything like before. So this might mean a lot of psychological pressure, a lot of social pressure on his mind. He might draw himself into a cocoon. He would not feel like meeting his friends, he would not feel like attending any kind of a social gathering. So chronic illness and disability call for a lot of psychological and social readiness also. how do we deal with this chronic illness and disability? The stresses of chronic illness and disability, just as we discussed now, can be severely taxing on the mind of the person. Even the most optimistic of persons, even the most positive thinkers can be marred of their confidence because of the chronic illness and disability. It must be dealt with every day, day after day, month after month, year after year, and one big fact is that there is no possibility of cure. While chronic conditions do vary in their severity and in the extent to which they interfere with normal life, each chronic condition brings with it at least some of the following problems and challenges. What are these challenges? Let us take a look. First and foremost is managing the medical crisis. Your chronic illness will call for a regimen adherence. You need to take a pill in the morning, a pill in the afternoon, a pill in the night. You need to strictly adhere to this kind of a regimen, and if you don't, your condition is going to worsen. So, the chronically ill or disabled person has to manage his medical crisis well. When things are going well, it is fine. He can lead a very normal life. He can feel quite good about himself. When things go bad for the person, he or she can be quite ill and even in some kind of significant danger. A person, for instance, who is suffering from emphysema can become so short of breath that he or she collapses in the street. A diabetic can self-administer the wrong dosage of insulin and end up in coma. The chronically ill individual often must remain alert, vigilant to recognize such kind of medical crisis. What best can he do is to carry the related equipment with him. For instance, if he is a heart patient, he should ensure that he has a telephone or a mobile in ready access so that he can get in touch with people whom he wants to whenever there is a case of emergency, so that he can communicate his condition. Some must carry with them the necessary treatments to deal with a medical crisis. The patients may have to avoid certain situations and conditions altogether so that they do not precipitate such emergency situations. The emphysema patient may completely avoid social interaction in order to reduce the chances of becoming emotionally upset and experiencing impaired breathing. This kind of vigilance can be very much taxing on the chronically ill person and require him to learn a considerable amount about self-care before he actually decides to go out in the public. Another aspect that the chronically ill and disabled person should be careful about is to control their symptoms. Nearly every chronic illness comes up with some kind of distressing symptoms with which its victims have to cope. These symptoms can be mild or severe. Mild symptoms can be managed well by the patient, but when these symptoms are severe, they are really debilitating. Then greater is going to be the adjustment that the person has to make in his day-to-day life. There is also the social acceptability of these symptoms which influence the measures that people must take to control their condition. Symptoms that limit the person to speak coherently or that make salient bodily processes that are normally private are likely to be quite difficult to adjust to. Some chronically ill persons fear that other people will reject them because of their disabilities. Many people with obvious physical alterations and limitations meet with the expressions of pity and disdain. This, of course, is a very common condition. When we see a person who is disabled, what do? Do we treat him like a normal person? No, we immediately mutter amongst ourselves, oh so sad, what a condition he is in. We pity with the person, but we should ensure that we do not do such things and let the person be. Therefore, they work to conceal or minimize the intrusiveness of these deformities in their bodies and limitations in their abilities. When symptoms of the chronic illness are under control, victims can lead a very enjoyable and pleasurable life. Another challenge that the chronically ill and disabled people face is that of carrying out treatment regimens. It has been found that adherence to the medical regimens is surprisingly poor in the chronically ill and disabled persons. This non-adherence is a particular problem for patients with chronic illnesses because their treatment regimens are often very difficult, complex and intrusive and interfere with enjoyable activities. For example, let us take the case of a diabetic patient who depends solely on insulin. There are so many people who manage their condition just with the help of tablets, but this case is one which needs regular administration of insulin. So, what happens when he has to go out on a tour? He has to carry enough number of insulin injections, and if his condition is heavier, probably he will have to take the injection once or twice during the entire day. So, it means a lot of emotional taxing on this person's mind, and he will not be able to take part casually in whichever activities he wants to. Further, this person must carry out all these activities throughout his life. These factors have been shown to predict low levels of adherence to the treatment process. The complex arrangements that many chronic illnesses demand may be they are almost lifelong. Patients who fail to carry out treatment regimens for chronic conditions are often trying to manage their daily lives within the confines of many practical, social and financial constraints. Some treatment regimens may cause the patient a certain amount of emotional distress as well. Examples are self-administration of injections, a case we have discussed just now. Inhalation medication for asthma, whenever the person experiences a bout of breathlessness, he has to take his Asthalin, or the application of bad smelling creams if a person is suffering from long-term skin problems. Some treatment regimens cause distressing side effects like pain or nausea. So, there are a lot of things that the person with chronic illness has to keep in his mind and then carry out activities that will make him remain and lead a confident life rather than withdraw into a cocoon. Increasingly, modern technology tends to make patients passive rather than active participants in their own medical care. Research shows that patients who take an active part in their medical care typically take better control of their chronic illness than those people who do not take good care of their condition. The best adjustment to chronic illness is usually achieved when the patients who learn that they must care for themselves rather than depend on some XYZ to take care of them. When they understand this aspect, they will get down to having a timetable, they will get down to having a day-to-day activity list, and then ensure that they are meeting all the requirements of the treatment regimen. There are self-help groups where this person can go meet other persons who are also in the similar boat as he is in and discuss the various things related to the chronic condition. Often these groups are found to provide a whole lot of information which even the doctor may not be able to provide. The doctor is unable to provide because he does not have time. He has number of patients to attend to, but when the chronically ill patient attends a self-help group, he gets to know how the others are dealing with their incompetencies. He has a chance to learn how he can better his life. These groups will provide practical help and also information such as where to buy or rent special equipment if your condition calls for it. There may be a lot of ideas for managing the symptoms of the chronic illness which you have not heard of so far. So, adhering to the treatment regimen cannot at all be challenging if the person himself is motivated to do so. Another aspect is coping with uncertain prognosis. Majority of the chronic illnesses do not show a steady pattern of symptoms in the life of the patient. Therefore, there is uncertainty looming large in the patient's life as he does not know what is going to be the next course of direction of his condition. When the symptoms are low, the person is leading a very normal life. But when the symptoms are severe and when the illness intensifies, he or she is totally taken off guard. Vigilance, vigilance and vigilance. This is the only thing that can keep the person careful in the management of his condition. When the disease will flare up is one aspect that is not known to the patient as well as the doctor. So, the patient has to make some kind of physical and emotional adjustments to his or her lifestyle. One of the major difficulties experienced by many of the chronic illness patients is that their inability to plan well ahead regarding many things. Everything they have to tackle only by the day. Long-term planning is something they should forget because of their condition. They very often cannot predict what kind of ailment, what kind of physical state they will have to end up in if at all they go on a tour. Avoiding or adjusting to social isolation. Chronic illness can many times push a person into isolation. There are serious social consequences. The practical limitations of a debilitating physical condition will make it impossible to maintain social ties. What happens as a result? The person loses contact with all his friends to the point that he very rarely has contact with anyone outside his family. The patient who is in treatment for cancer, for instance, may have too little energy to go out for the get-togethers that his friends are hosting. The complex scheduling of renal dialysis for the patient who is suffering a kidney failure may leave little free time during which he can think of socializing. The cardiac patient may need to avoid coffee breaks with his co-workers in the office. Why? Because these situations will intensify the desire to smoke cigarettes, which he is not at all supposed to engage in. The severely diabetic patient might avoid parties or dinners with friends in order to avoid temptations to deviate from the strict diet regimen that is a part of his treatment. Many victims of chronic illness and disability eventually adjust socially. They develop ways to continue relationships with their perceptive and sympathetic friends under conditions that they and the disease can tolerate. Many find that as a result of the necessary adjustments that they have made to their life, they and their friends are able to form deeper and stronger relationships now than earlier. Another aspect that is important in the management of chronic illness and disability is setting concrete goals and making plans for the future. Yes, setting goals is one aspect that will introduce an element of organized dealing in the chronically ill patient's life. Regardless of their health status, people have a need to conceive of their own futures and orient themselves towards goals that they value. Chronic illness can rob people of their future orientation. As chronic illness renders the future so uncertain, the ability to plan and strive for future goals may be severely compromised. But those who cope most successfully with chronic illness are those people who have planned, who have set a goal for themselves and stuck to the plan. Initially, short-term goals are set, and once they are reached successfully, long-term goals can be set. When we are talking about long-term goals, we are suggesting that the amount of difficulty is going to be a bit high. For example, those people with disfigurements should first try to come out in their close circles, and when they overcome their shyness or feelings of diffidence, they can just go to the higher level of a circle, and only then, once they are comfortable, can they mingle in their society. In strategizing for the future, the chronically ill person must often consider and even prepare for a range of possible outcomes. For example, as graduation approaches, a physically handicapped person can plan well in advance for a wheelchair in case he is unable to walk like he used to do earlier. Chronic illness permanently changes an individual's life and forces him to face and adjust to restricted life choices. Limitations in certain areas, however, unexpectedly open up other possibilities. If you are not able to run like earlier, now you may sit and do some other academic activity of your own interest. There is a lot of scope, there is nothing to lose heart about. Only thing is that you need to stick to your treatment regimen and then focus on the future. There is every chance that the individual may discover his hidden talents that might never have been recognized and developed earlier. So, some of the changes that take place in the individual's life is for his own good. How families can cope with a person who has become chronically ill or who has become permanently disabled. It is definitely going to be a challenge. For a mother, if the child has become chronically ill or disabled, it means a lot of psychological and emotional stress for her as well along with the child. Families cope with chronic illness in different ways depending upon the nature and timing of the illness, the limitations it brings about in the person's life, and a various host of other factors. Some families get closer and some move apart. A few develop considerable resentment and the patient becomes a source of chronic stress for the family. The character of the family adjustment prior to the illness can be a very important factor in the post-illness coping. The pressures of illness and disability can cause a basically stable family unit to mobilize resources to deal with the crisis and to adjust to the long-term effects of the illness. In a family that was functioning well so far, coping with the chronic illness becomes easy. The individuals adjust to their roles with respect to one another and cope with the difficulties that illness and disability brings along. There are psychoeducational programs provided to the chronically ill patients. These programs will provide them with a lot of information where they can go to, from where they can secure the material that is needed for coping with the condition and a whole lot of other things. They can also make use of a variety of approaches to help the patients and their families as well to cope with this condition of chronic illness and disability. At times, the services of a caregiver can also be hired, but depending on the intensity of the situation only can someone opt for the services of a caregiver. Again, depending on the intensity of the chronic illness, the caregiver also suffers from psychological stress, emotional stress and feels physically exhausted from the day-to-day care that he is offering the chronically ill patient. Family members can definitely be the main source of inspiration and the entire support system for a chronically ill or disabled person. They can help the person by providing him a lot of physical care and emotional care. There are many people who are leading comfortable lives despite having fallen prey to chronic illness and disability. A little bit of compassion, a little bit of understanding and a lot of practical knowledge when given to the patient will help him sail through the remaining part of his life effortlessly.